Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Thyroid neoplasm, we're looking at the AJCC 8th TNM staging. So there is a differentiated thyroid cancer. The age cutoff which is used is increased from 45 to 55 years of age, and this is a diagnosis. And then the minor extra thyroid extension is detected only on the minor extra thyroid extension. So this is detected only on the histological examination and is removed from the definition of T3. It is detected only on the histopath examination and is removed from the definition of T3. Removed from T3 definition, and therefore has no impact on either the T3 category or the overall stage. So it does not affect the T3 as well as the overall stage. Next is the N1 disease. So here in the N1 disease, it's no longer upstages a patient of stage 3. And if is no longer upstages a patient to stage 3, and if it is less than 55 years of age at diagnosis, the N1 disease is stage 1. So N1 disease is stage 1. And if it is greater than 55 years, here the N1 disease is the stage 2. Next we move on to the T3. So T3A is a new category for the tumors that is greater than 4 centimeters. This is confirmed in to the thyroid gland. Next is the T3B. So here in T3B, it's a new category for the tumors of any size demonstrating the gross extrathyroid extension. So this shows the gross extrathyroid, the gross extrathyroid extension, and this extension is into the strap muscles. The strap muscles. So what is the strap muscles called? The strap muscles are nothing but the sternohyoid, the sternothyroid, the thyrohyoid or the omohyoid muscles. Then when we move on to the level 7 lymph nodes, the level 7 of lymph nodes is previously classified as the lateral neck lymph nodes. So it was previously the lateral neck lymph nodes, and that is the N1B. This is reclassified as a central lymph node. So it is reclassified into the central lymph node, that is N1A. And this is to be more anatomically consistent. So it is anatomically consistent, and because of level 7 presents significant coding difficulties. So level 7, it presents significant coding difficulties. This is for the tumor registrars, with the tumor registrars. Next, the clinician and the researchers. Now, in differentiated thyroid cancer, the presence is distant metastasis. So, in terms of the differentiated thyroid cancer, the presence of distance metastasis. So, distance metastasis, that is M1, in older patient is classified as, in older patients, it is classified as 4B rather than the IVC disease. So, it is classified as 4B. It is classified as 4B disease rather than the IVC disease. The distance metastasis in anaplastic thyroid cancer continues to be classified as the IVC disease. Metastasis in the anaplastic thyroid cancer, this is continued to be classified as IVC disease. Now let's move on to the TNM classification. So here in TNM staging, we will first look at the 7th AJCC. So here in terms of TX here it can't be assessed in the 7th. So we are just focusing on the 7th and it can't be assessed. Next, when you look at T0, it is no evidence of cancer. So 0 means no evidence of cancer. Now T1 means it is a tumor less than equal to 2 centimeters and it is intrathyroidal. And here when you look at T1A, it is less than equal to 1 centimeters and is intrathyroid. Now when you look at T1B, this is 1 to 2 centimeters, that is intrathyroidal. Next we move on to T2. T2 signifies it is 2 to 4 centimeters, it is intrathyroid. Intrathyroidal. Next, let's look at T3. T3 means that it is greater than 4 centimeters and it is limited to that of the thyroid. It is limited to that of the thyroid or any size to minimal extrathyroidal extension. So greater than 4 centimeters is limited to the thyroid or any size with minimal extrathyroidal extension. Any size with minimal extrathyroidal extension. So this includes the muscles and the soft tissues. So muscles as well as the soft tissues. Next we move on to T4. So in terms of T4, there is a T4A as well as T4B. So T4A, it invades the subcutaneous tissue. So there is a SE tissue and also the larynx. So subcutaneous tissue, there is a larynx as well as the trachea and the esophagus. And also the RLN, that is the lymph nodes. Now T4B. T4B, what does it include? It invades the prevertebral fascia. So there is prevertebral. So prevertebral fascia and or encases the carotid or mediastinal masses. So it encases. So it also encases the carotid. So it encases the carotid or the mediastinal vessels. Next, let's look at the. So here the one thing to notice in edition 8, what is T3? So here in edition 8, the T3, it is divided into 3A and 3B. So 3A here, it stands for the tumor greater than 4 centimeters and it is limited to that of the thyroid. Now when we move on to the T3B. So T3B. So in terms of 3B, there is a gross extrathyroidal extension. There is a gross extrathyroidal extension and this invades only the strap muscles. So this invades the strap muscles and that it includes the sternothyroid. There is sternothyroid and next is the sternohyoid as well as the thyrohyoid and the omohyoid muscles. And this is from a tumor of any size. There is a tumor of any size. Now let's move on to the regional lymph nodes. So here in regional lymph nodes, in short it is known as the RLN. So here in regional lymph nodes, there is NX. NX stands for the regional lymph nodes and cannot be assessed. And N0 means it is there is no lymph node metastasis. N1A, this refers to the positive in level 6. It is positive in terms of the level 6. And it is unilateral or the bilateral disease. It is unilateral as well as the bilateral disease. Now when you look at the 8th edition, the N1A is classified as the metastasis, and this is to the level 6 or 7. So it is 6 or the 7. It is unilateral or bilateral disease. It is unilateral or bilateral disease. Now let's move on to the N1B. So what is this N1B? N1B means that there is a metastasis to the unilateral. So this is the metastasis, and this is to the unilateral or the bilateral or the contralateral neck lymph nodes. The contralateral neck lymph nodes. So what does it include? It includes the levels 1, 2, 3, 4 or 5, or the retropharyngeal lymph nodes or the retropharyngeal lymph nodes. Now let's look at the distance metastasis. So here M0 means there is no distance metastasis, M1 means the distance metastasis is present. Now next let's look at the TNM classification of the thyroid. So here under the TNM classification, we are going to see under the 7th edition and 8th edition wherever necessary. So in terms of the 7th edition, it is less than 45 years. Here it is. And in 8th edition, it is less than 55 years. This is in the 8th edition, this is in the 7th edition. Now, what is category 1? Category 1 includes any T, N, any N or M0. Next, when you look at 2, it is any T, any N as well as M1. Now, comparing the age groups of greater than 45. And on the 8th edition, greater than 55. So grade 1 here, it is T1, N0, M0. And here it is T1 to 2 and N0, M0. Then we move on to the second classification. So in terms of class 2, there is T2, N0, M0, and when you look at the TNM AJCC 8th edition, there is T1 to N1 M0 or T3 to any N or M0. Then we move on to the 3. 3 is T3 N0 M0 and T1 to T3 N1A to M0. Now looking at the AJCC 8th edition, here it is a T4A and any N and M0. Now when you look at 4A there is a T4A, the N0 to 1A M0, and there is also the T1 4A. This is from N1B to M0. And looking at the 8th edition, it will be the T4B and any N. It is any N and M0. Now let's move on to the 4B. So what is 4B? So here in 4B, it is T4B and it includes any N as well as M0. Looking at the 8th edition, it is any T, any N as well as M1. Then moving on to 4C. 4C means it includes the 7th edition, that is any T, any N and it is M1. Now let's look at the MTC, that is the medullary thyroid cancer. So MTC, medullary thyroid cancer, here also there is, we are looking at the 7th edition. So in terms of the TNM 7th edition AJCC, in 1 it is going to be T1 N0 M0. This is in terms of 1. Next when I go to in terms of 2, it is T2 to T3 and it is again N0 M0. Then when you look at the 3, this is going to be T1 to T3. This is N1A and M0. Now when you move on to 4A, 4A is going to be T4A and it is any N or M0, and it is also going to include T13, N1B and M0. Next when you move on to the 4B. So what is 4B? T4B, this includes T4B and NEN and M0. Now what is 4C? It is any T. 4C means it is any T, any N as well as M1. Now let's look at the anaplastic. So unlike the previous editions where all the anaplastic thyroid cancers were classified as T4, so everything was classified as T4 earlier, the anaplastic cancers are now use the same T definitions as differentiated thyroid cancer. So now they use the same T definitions. So in terms of the intrathyroidal disease, so the intrathyroidal diseases, this includes the T1 to 3A. This is nothing but the stage 4A. Now when you look at the gross extrathyroidal extension, this is nothing but the T3B and the T4, or the cervical lymph node metastasis, So here it is nothing but the N1 and this is stage 4B. Then when you look at the distance metastasis, it is nothing but M1 and they are at the stage 4C. Now let's look at the anaplastic cancers. So in anaplastic cancers, we look at the 7th stage. That is in terms of 4A, it is T4A and it is NEN and M0. Then when you look at the 8th edition, it will be T1 to 3A, N0, M0. Now 4B, this will include the T4B and NEN or M0. And in terms of the 8th edition, it is T1 to 3A, it is N1, M0. Then T3B, NEN and M0, and T4, that is NEN and M0. Now 4C, it includes in 7th edition, that is any T, any N as well as M1. To learn and grow daily like this, please do subscribe.